I wanted to bring today's episode to the podcast talking about male factor infertility. As you know, we coach couples in our couples coaching program, and we're predominantly dealing with female factor infertility, but there are times that we are also dealing with male factor infertility where people, their men are dealing with low sperm count, motility issues, DNA fragmentation. So looking to optimize the health of both partners, not by focusing on the diagnosis, by looking at the whole body, using functional testing, looking at blood chemistry, what are the healing opportunities that have been missed. Excited for you to listen to this episode, male factor infertility, what has been missed, what you need to do right away, what tests that should be run, what steps you can take right now to optimize male fertility. Thanks for listening. Hey there. I regularly speak with 5 to 10 couples per week who are struggling to have their baby. And although we want to help everyone, we only have 2 spots available per month to work with us. So the Supercharge Your Fertility Discovery call is for action takers and really people who are ready to move forward so they can finally have their baby. And if you're not ready and you wait, the risk is you'll need to wait 2 to 3 months for a spot to open up. So if you're seriously considering working with us, go to Fab Fertile, F-A-B, fertile.com and click on book a free call. Then you'll be all booked in and ready to spend 30 minutes to give you the action plan to getting pregnant naturally. That's Fab Fertile, F-A-B, fertile.com and click on book a free call. Hey there. Thanks so much for listening to the Get Pregnant Naturally podcast. And I've got a favor to ask you. If you are enjoying learning about the functional approach to fertility, consider going to iTunes and rating and reviewing the podcast. This is how it helps the show reach more people that are struggling with infertility, knowing that there's another approach that really can get to the bottom of why it's not working in the first place. So all you need to do is, if you're on the app or the desktop, just go in and consider leaving a 5-star rating and leave a review. And there is step-by-step instructions in the show notes showing you exactly how to do that. So if you can just take a few minutes, just take the few minutes right now. You can pause this recording, come back, leave the review. It would really mean the world to me and help others that are on the fertility journey as well. Take care. One theme that keeps coming up with the couples in our Fab Fertile couples coaching program is sleep. Whether it's insomnia, having a hard time falling asleep, waking up at night, or feeling tired when we wake up, sleep is critical for fertility and hormones. And that's why I'm so excited to have Blue Blocks as our podcast sponsor. So we're exposed to blue and green light from our phones, our tablets, our computers, indoor lights, and more. And this exposure impacts our melatonin production. And melatonin is essential for both female and male fertility. It helps determine the frequency and duration of our cycle and impacts sperm. There's lots of blue light blocking glasses on the market, but the ones from Blue Blocks, they've actually compared other popular brands, and Blue Blocks block 100% of blue and green light, while other brands fall short. So I have their sleep glasses. They have red lenses, and the ones I have are a little translucent frame, and they're so stylish and really cool. And so they eliminate 100% of the blue and green light in the 400 nanometer to 550 nanometer range. So this is exact range that has been shown in clinical studies to disrupt melatonin and negatively impact your sleep. So all you do is wear your sleep glasses after sunset until it's time for bed, and you'll notice improved sleep after just one use. And it's also cool to use when you're flying for managing jet lag. So I got to say, I was a little skeptical about the noticing improvement after one use, but literally I use these glasses and my sleep is actually already pretty good. I used them for one day, and I have to say, after one day, I had the best sleep of my life. I just felt so rested. So these glasses, they ship free and they're tracked for all orders anywhere in the world. And also they have all their frames come in prescription, non-prescription, and reading glasses. Plus you can send in your frames and they'll add the blue light blocking and green light blocking lenses to your frame. So this is an easy hack that you can add to your fertility toolkit. All you do is go to Blue Blocks, BLUBLOX.com. Use the coupon code GetPregnantPodcast at checkout and receive a 15% discount. That's Blue Blocks, BLUBLOX.com, and use the coupon code GetPregnantPodcast to receive your 15% discount. I didn't need to go to donor eggs. Obviously, I don't regret it. I have beautiful children. I could have done things differently, restored. I was still cycling back in my 20s. I could have looked at my health, the environmental toxins, the stress I was under.
Many women are being told their eggs are too old. That's often merely an assumption that's not based on actual evidence. The reason being that there is no direct test of egg quality. You can't test egg quality.
It's the man who's got a food sensitivity or he has a zinc deficiency.
Like there can be a root cause to these symptoms that are, quote unquote, period problems, that the doctor will pass you a pill without any question of why.
And some part of you knows that if you can reframe your journey from not want to struggle, or if it is struggle, learn how to embrace the struggle. Learn how to embrace it.
Most conditions in the child occur during the 9 months of development. It's the genetic switches are turned on or turned off, and they're pre-programmed. So you are in such a powerful, amazing position to do amazing things for your kids.
Why is IVF the first step? Because we believe it should be the last step. Welcome to Get Pregnant Naturally, where functional medicine and natural fertility solutions will help you get pregnant and have your baby. Hey there, I'm Sarah Clark, founder of Fab Fertile and your host. I believe the functional approach is the first step for anyone struggling with infertility, and my aim is to help you get pregnant naturally. Today, I'm welcoming Dr. Ralph Esposito to the podcast, and we're digging into how to improve sperm health. Dr. Esposito is a naturopathic physician, acupuncturist, and functional medicine practitioner specializing in integrative urology, men's health, and hormonal health. His precise and personalized style utilizes a systems biology and precision medicine approach to medicine. In addition to being a peer reviewer for medical journals, he has authored several medical textbook chapters and has designed education modules for health professionals specifically on urological conditions, male and female hormone dysfunction, hypogonadism, exercise, men's health, and sexual dysfunction. Dr. Esposito has trained at the NYU Integrative and Functional Urology Center and also holds a position as an adjunct professor at New York University, where he lectures on integrative medicine. Currently, Dr. Esposito serves as a medical consultant and research analyst. Thanks so much for listening, and I'm so thankful that you're here. Make sure you hit subscribe, and if you know someone else who is on the fertility journey, please share this podcast with them. Hey, Dr. Esposito, excited to have you on the podcast.
Thanks so much, Sarah, for having me. I really appreciate it.
Awesome. So can you share your journey as to how you came to do this work?
Well, at first it all started without any type of major interest in men's health or fertility for men and for women. It started with just trying to figure out what was going wrong with the conventional medical system and why it was failing so many people in my family, particularly my father, who suffered with chronic illnesses all throughout his life before his passing with Alzheimer's a few years ago. As I was growing up, I was very overweight and kind of heavy. And, the doctors would always tell my mom, if your husband is sick at 47, your son's going to be sick at 37. And I started to realize, well, that's not good. I just kind of thought, a medication or a supplement would kind of help me. And it actually didn't really turn out to be that way for my dad. And I started realizing, well, there's a lot more to just taking a pill and hoping that it'll solve problems. And eventually I started learning more about naturopathic medicine and considered going the conventional route of becoming a medical doctor or a DO. But I found that really wasn't something that I was very interested in and didn't find address what I thought was the right thing to do and how to help people. As an undergrad at NYU, I started investigating a little bit more about naturopathic medicine and learned from one of my mentors, Dr. Gio Espinoza, who is a naturopath and also an acupuncturist as myself. Got nerdy and very deep dive into all things men's health and understanding everything that there is to know about men, their health, their hormones, their fertility, all the above. The mind-body connection is really important, and just decided to engulf myself in all of it.
Yeah, thanks for sharing that personal journey with us. I find most people come to this way of looking at things because of something that they've experienced in their life. Yeah, I really wanted to dig into today's topic. So we coach couples in our couples coaching program, and although we primarily are dealing with female factor infertility, even when the male partner is like, my sperm is fine, or even when it is not, there's always things that they can do from a diet, lifestyle, functional approach to improve that. And I think a lot of times people don't really know where to start. So I wanted to dig in today's episode, starting out with, if you could explain to us the difference between sperm count, motility, and morphology.
The sperm morphology, which is kind of not so straightforward, is essentially tells you how do the sperm look. The size, their shape, do they actually look like they would appear to be normal under a semen analysis. If a scientist or a technician would look at it and say, okay, well, how much of these look normal or the typical head and tail, and then how many have two tails or three tails or two heads, right? Or looks a little bit dented or varied, right? So that's morphology, because you want to be able to have a healthy sperm, obviously because you want a healthy sperm to implant or fertilize to help with implantation, but you also want to make sure that you have healthy sperm that are going to be able to reach the egg. So that's part of the morphology. The count kind of tells you how many total sperm are in there. It doesn't necessarily tell you the concentration. So it'll tell you whether there's a low sperm count, which can have an indication of is the man or are the testes able to make enough sperm. So that's one important factor, because if there's not enough there, then the odds of one of the sperm reaching the egg is decreased. And then the motility tells you how they move, how often, how quickly they move, and the percent of all of the sperm in the whole semen analysis. Do they seem to be moving in the right direction? Some of them might not move at all. Some of them might move in various directions. And that's all assessed by under a microscope, under analysis. And that is what all determines, among other things, what's considered to be normal or healthy, or can give you some indication as to whether there might be a male factor involved in the fertility issue.
And what are the parameters for each? And if then looking at optimal levels as well, those are different.
Yeah, so it varies based on the lab. The WHO has slightly lower standards, which is a little odd. They've lowered their standards, I think, about 5 years ago. So I guess more men are now qualifying as normal, which is not surprising, and many labs do that pretty consistently. In terms of morphology, it's usually in percentages. So the reference range is usually, you like to see it, or the reference ranges are usually around like 20 or 30 to obviously 100%. Ideally, you want to see that above. I like to see it above 50%. When I go into optimal versus normal ranges, there might be men who are not in the optimal range, but still are able to conceive with their partner. So that doesn't necessarily mean it's not possible, but in terms of giving yourself the best chances, you like to see the morphology of 30 to 50% or higher. The motility also is usually calculated as a percentage, and you want to see that also about 50 to 100%. The higher, the better, because obviously better movers are more likely to get to the actual egg. In terms of sperm count, I usually look at it in terms of concentration. You can look at total motile count, so that'll tell you how many of the sperm are moving, and that you want to see upwards of the 20 to 30 million. When you look at concentration, which is a little bit more important, because if they are not concentrated, then that tells you that if they are concentrated, if the sperm concentration is high, then that tells you that there's a lot of sperm per unit volume, and then there's more likely to have a beneficial response. And that is, we like to see that above the 30% range or so.
Okay, so count 20 to 30 million, and is that the optimal level, or what is the optimal level?
Yeah, I like to see it. It doesn't necessarily mean, as I mentioned before, that higher is always better. All of these things come into consideration within the context. So it's not just one marker that you have to look at. So when I look at all these together, if the total count is normal, or we'd say, like, let's say it's in the 30 million, but the morphology is down and the motility is down, or perhaps there's other parts of the semen analysis that can impact the number, then that number becomes a little bit more important. Whereas if everything else is normal, but the total motile count is low, then it's more of a concern. But ideally, I like to see it. That would be my optimal range, is above the 20 to 30 million.
And so there's been a significant decline in sperm count over the last probably 50 years or more. Can you talk about that and what you're seeing?
Yeah, so we are actually seeing a lot more of this, and unfortunately in younger men. Mm-hmm. I think there are a multitude of factors that are going on. Number one, I think a lot more Americans are exposed to environmental toxins. This includes things from like amalgam fillings and pesticides that are getting into our foods or getting into our water supply. We have a very poor way of assessing this because you can only know if a food is organic or not. You can't really understand or know how much pesticide is found on that particular food or how much environmental toxins you're being exposed to, right? It's not like, okay, well, if you live in New York City, you're exposed to this much toxin compared to living in Wyoming. We do know that there are more environmental and toxic exposures in urban areas. And I think that's largely what we're seeing now. That we're getting a lot more urban areas where these water supplies are a little bit more exposed. The food supply is also a lot more exposed, and that's contributing to some of the issues. But largely what I do think is happening is that I think there's a lot more obesity and insulin resistance that's going on in men that we're not really catching. And it's leading to chronic inflammation that over time is going to damage the quality of your sperm because of any of the cells in your body, your sperm are usually one of the most sensitive to oxidative damage. That's part of the reason why the testes sit outside the body. It's because heat can promote oxidative damage, and by keeping them outside, we keep them cool. But it doesn't change the fact that they can be exposed to oxidative damage internally, not related to heat. And pro-inflammatory lifestyle, alcohol, poor sleep, smoking, which I hope nobody's doing anymore, but it happens, is going to contribute to these numbers that we're seeing.
Mm-hmm. The water, the food, and then also, obviously, as you're saying, with the weight, with the BMI and obesity, and 60% of, I think, North Americans are in the obese range. Yeah, and we're seeing that a lot too with the insulin resistant side of things. And I think that being missed as you're talking about higher inflammation.
Right. To your point, you're seeing a lot more of that, but how much are we not seeing? Mm. And then how much are other doctors not seeing or is going, underdiagnosed, right? Because you've already alluded to this, optimal is different than normal. And that applies to a lot of areas of medicine.
And so you talked about the oxidative stress. Can you talk about that? So the impact on sperm, we talked a little bit. If we can dig into prescription drugs and sort of things like that, what are you seeing?
The oxidative damage obviously is just damage to different parts of the cell and different organelles within the cell. So with a sperm, there's the one thing that's most important is the chromosomal data that's found on the sperm cell. And that's why men have we have an X and a Y chromosome, and that sperm, whether it's carrying an X or a Y, is not necessarily meaning that that's going to change. The oxidative damage is going to change that, but it's going to cause potentially epigenetic changes to that DNA. And the sperm does a lot of things to kind of protect that DNA because it's very valuable. It's basically the one time that we get to expand and spread our pedigree, right? Our heritage. And that's essentially the goal of evolution and natural selection, right? When your sperm is being attacked by excessive amounts of oxidative stress, more than what it's typically exposed to. And I'm not talking about when it's outside of the body. I'm talking about when it's inside and growing, right? When the spermatogenesis is actually occurring. These are the vulnerable times where the sperm can be exposed to this oxidative damage. And essentially what we see is that things like heavy metals can be contributing to this, which is not uncommon, but is not the most common. So I do like to rule those out for a lot of men. But you also have to look at things like, are there certain pesticides that you're eating that might be contributing to this? And they're metabolites. You can also be looking at organic molecules or organic bacteria that are creating these pro-inflammatory molecules, right? Or any type of infection that might be contributing to some inflammation going on. And it's these cytokines and these inflammatory molecules over time, they set off this inflammatory cascade. And that leads to a systemic inflammation, and the testes oftentimes can be affected by that. But you also cannot discount the fact that the contaminants that you're seeing, like PCBs and DDT and other organic pollutants in our environment, are finding their way into our cells. And that's what we have to be aware of. And that oxidative stress, the ways that we protect from it, given certain antioxidants that our body makes, and that we consume, there's a finite reserve. And over time, the body would just be overwhelmed.
Yeah, it's interesting doing the hair tissue mineral analysis when some of those different heavy metals and coming up on the test there, kind of like, oh, where are you getting that exposure to uranium? Or, oh, wait a minute, you live close to a farm that's, spraying pesticides, or maybe you are a farmer and, oh, wait, why do you have, higher different, lead or different, things that you're exposed to? It's interesting to see what comes up there.
Yeah, you can, I do hair, urine, and blood levels of heavy metals to get a kind of a full picture. And you can see these numbers and like, well, I have no idea where, my lead is being exposed, or I'm getting exposed to lead or mercury. And it's very, the easy one is mercury, right? It's like fish or amalgam fillings. And like everybody thinks that that's all. Unfortunately, there's so many areas in our environment that these things can be incorporated into our lifestyle. And even just, as healthy as plants can be, they also absorb everything from our environment. So as you mentioned, some farmers, yes, they can get this stuff from the pesticides that they're using or the chemicals that they're using, but are they growing their crops on healthy, fertile land? And if they're not, then you consume that. And the same thing goes with the cattle that are consuming the corn. And do you remember, it might have been a few years ago, where there was that whole news article on the arsenic in chicken? Mm-hmm. Yeah. Well, that wasn't because we were feeding them like straight up arsenic. No, it was because the feed and that these chickens were consuming, they thought it was corn and other grains, but it actually was completely contaminated with arsenic and other heavy metals, and that's what was contributing to a lot of the issues that we were seeing.
Yeah, we also see it high if someone is eating a lot of rice, that arsenic comes up.
Exactly. Mm-hmm. Exactly right.
And can you talk about, so let's dig into the, I don't know if I always pronounce this wrong, but I'm going to go for it. The varicocele.
Varicocele, yeah.
There you go. Yeah. How that one would impact sperm.
A varicocele is basically, in medicine, when you can notice a varicocele, you can feel it. It kind of feels like a bag of loose, tiny bag of worms or noodles, right? It doesn't feel like a typical testicle. The purpose of your testicles, as I mentioned earlier, are to stay warm. To stay cool. You don't want them to get warm. Many men will know this, that when they get warm, that their testicles tend to drop a little bit more. And this is a normal response. It's the cremaster muscle that actually helps control whether they move up or down. What happens is that when they get warm, they need to get farther away from the body so that they can cool down. And that helps to extract a little bit more heat. Most people think it's just because, they get farther from the body, so the body's warm, so they stay away from the body. Well, that's true, but also what it does is it elongates these veins and these arteries that feed the testes and the various structures, the epididymis, etc. When you elongate a tube, right, you are able to extract more heat or incorporate more coolness into the arteries. So if you had two long straws, right, the longer you extend them, the cooler it would get. So the way I kind of express it to some men is like, stand in a shower. And if you stand in a shower, right, if you have your head at the shower head, it's really hot once it comes out. But if you like lay at the bottom, by the time you feel the water, it doesn't feel as hot, because that means you've extracted, or some heat was lost via thermodynamics from the time that it left the shower head to get to the floor. And that happens with your veins and arteries in the testes. So as your testes elongate or they drop, the veins get longer, and they're able to exchange heat with your arteries and kind of cool down the testes. But when you have a varicocele, those veins become enlarged, and sometimes they can become blocked, and that actually causes them to increase in their heat, or they become warmer, and that would decrease sperm production. In terms of just decreasing quality, and obviously that leads to fertility issues on many aspects. It may also contribute to decreased testosterone levels, which also will have an impact on your fertility.
And how often is that missed? Because I think sometimes men aren't even doing a semen analysis. It's the woman doing all the changes, and then, by the way, he gets a semen analysis, but then to have him have a full physical and workup. So are you seeing that missed? And at what point, obviously in the very beginning, to get that looked at?
Yeah. So most urologists should do a testicular exam if there is a complaint of infertility. Mm-hmm. The the problem is that there's oftentimes not a complaint of infertility from a man. It's usually a woman. I find now, and I might be biased because I think I surround myself with a lot of great clinicians who I trust, and we all have an eye out for this kind of stuff. But I would say a very novice practitioner or even a primary care physician where this is not really their specialty, sometimes even an endocrinologist, sometimes they might miss it. And I can't say how often it is, but it's more common than we actually think. Mm-hmm. I would say about 20% of the population of men sometimes may experience a varicocele, and to think that there's a lot more that have been missed there. So I would imagine that's even a little bit higher.
So really so not necessarily your GP, getting a referral to a urologist if you're, in the beginnings of the journey to make sure to rule these things out. So you don't go for years and years trying when you have that issue.
Absolutely right.
And then can you talk about prescription drugs and how those impact sperm?
Sure. Well, was there a prescription drug in mind or just in general?
I don't know. Like, what about one for epilepsy? If someone's taking that long term and how that's impacting sperm?
Sure. It's speaking specifically to medications for epilepsy. I can't speak to that specifically. I can say is that we very rarely do you have a medication that's tested for whether it causes fertility issues or not. There's more medications now that medications are around for a lot longer, we're able to identify whether they are contributors to this or not. The one thing that I do say that has had an impact on fertility, and it may not be a direct impact on the actual, as an actual insult to the testes, but it's also, like stimulant type of drugs. Everybody now wants to be having the highest, most focused day and being the most productive. And that usually results in taking things like Adderall or Vyvanse or even caffeine or modafinil, right? You are constantly stimulated and you're constantly in a sympathetic drive that it makes it hard for your body to kind of relax and calm down and actually be able to procreate and be able to be fertile and have an erection. And those are the things that I've seen, pharmaceutical drugs that I've seen having an impact on men in terms of their fertility. Certainly there are other toxic medications and sometimes even high doses of NSAIDs like meloxicam or Celebrex over time. These are anti-inflammatory drugs, but they inhibit enzymes called COX-2, and these are certain prostaglandins. And these are prostaglandins that can be harmful at very high doses, but at low doses or in physiologic normal doses, they actually might be helpful in terms of improving sperm production. Anytime you go to an extreme, the risk of it impacting fertility is certainly there.
And if there's anxiety, depression, or any of those other ones too, so not just the focus ones, other ones like that potentially could impact as well?
Absolutely. So SSRIs and SNRIs, antidepressants, those will have a direct impact on, one, it'll decrease testosterone levels, and we think it does so by decreasing LH and FSH levels. And those are two hormones, as probably many of your female listeners have heard before. That in women, it helps them with ovulation. If they're doing IVF, that'll help them retrieve eggs and such. However, in men, it's important for spermatogenesis and obviously testosterone production. And we have seen a lot of antidepressants contribute to these issues. We see men who's like, well, I'm really down and I'm feeling lethargic and not energetic. And there's a lot of other issues for that. But antidepressants can certainly do that by impacting your hormonal levels.
What about aging?
Well, age is the one thing that we see. It's one thing we can't really control for. It's one of the risk factors we see all the time for decreased fertility, especially in men. And women, we know because they go through menopause and it's okay. Well, now you're not ovulating anymore and you don't have any more reserved eggs. So this is your time. In men, technically there's really no exact time, but we do know that men do go through some type of testicular senescence, right? These cells become old and they become less functional, and that impacts the way that they actually function. So age contributes to multiple issues. Number one, the Leydig cells and Sertoli cells they decrease in their function. The decrease in testosterone levels is about 1% per year after the age about 30 to 35. So we know that your Leydig cells are decreasing. Your Sertoli cells are also probably decreasing because there's really no need to fertilize or to procreate when you get this old, because you're not going to be able to actually be around. You're not going to be able to function. So in older days, of course, obviously now it's different. We do see age as that factor, but also as you age, you are under or more oxidative stress. Similar to a car, the older a car gets, the more worn down it gets, not because it's getting older, because it's being driven more and it's being put under a lot of wear and tear. And we need to do everything that we can do to actually reduce the wear and tear on the body. And that comes a lot with lifestyle.
So 1% at 35 and then kind of going down from there then.
I think it's closer to 30, but yes. Yeah. 30 to 35 is when you start having a decrease in testicular function.
And then, so with female factor infertility, specifically with low AMH and diminished ovarian reserve, premature ovarian failure, we regularly see undiagnosed autoimmune disease. And so as far as the male factor infertility goes, and undiagnosed autoimmune disease, the impact on sperm, what are you seeing?
I am seeing men who have autoimmune conditions. You have to remember that the testes are immunoprotected. So they are very often reserved or preserved when there is an autoimmune response going on. There is an autoimmune condition that might happen and attack sperm cells, anti-sperm antibodies, but that's very rare. It certainly can happen, and that can happen at lower levels. May not be full-blown autoimmune anti-sperm antibodies, so it may not be a frank autoimmune condition, but we see that if you do have low levels of these antibodies or the sperm start to agglutinate, which basically means they start sticking, then there potentially could be some type of autoimmune condition going on that's not necessarily captured. I can't say that's actually related to any other autoimmune condition, just being that I have not seen it enough to know that, okay, well, men who have autoimmune antibodies, anti-sperm antibodies also have RA or lupus. But anytime that there's an autoimmune cascade going on in the body, you have to assume that there's chronic inflammation going on, because that is at the root of what's causing the symptoms of autoimmune disease, and that's going to impact fertility no matter what.
And so the sperm antibodies, getting that checked sort of with that in the very beginning there with a urologist, or where would we do that?
It's usually involved in a semen analysis. Yep.
Okay. And then as far as infections, so we're doing stool testing using the GI map, and we regularly see bacterial infections, fungal infections, H. pylori being passed back and forth. What are you seeing with infections and then the impact for male fertility?
Yeah, I'm seeing a lot more right now in acute infections, such as may or may not be sexually transmitted infections, gonorrhea, chlamydia, syphilis, etc. But even other urinary tract infections in men that lead to prostatitis. And these symptoms can cause damage, chronic inflammation to the prostate. And it's not entirely clear if this is contributing to the infertility picture. But remember, the prostate is a gland that secretes a fluid. Most men think that their prostate's just there to get removed when they find out that it has cancer, but it actually has a fertility benefit. And it releases fluids to help keep the semen actually lubricated and at the right pH. And when you have chronic prostatitis, that is a result of a past infection or not, then we're seeing that having a contributing factor on fertility issues as well. I can't say that's very prominent, because most of the time, men who have chronic prostatitis when they're younger, obviously have the benefit of having highly functional testes and is not as detrimental to their fertility chances. But in older men in their 30s and sometimes 40s, when they want to have a new partner or want to conceive again, if they had chronic prostatitis, it usually can be a detriment to them. The other things that I've seen coming up more now is, more men are experiencing the small intestinal bacterial overgrowth and dysbiosis in the gut overall. And I can't say specifically if that's impacting their fertility chances, but it's impacting their health, and that's impacting their libido. And that it's much more difficult to have conceive a child without getting an erection. And that is a large factor, is what I'm seeing a lot in my men, is that these chronic infections, like the Lyme and the SIBO and the dysbiosis, are causing men to have a poorer quality of life, which is impacting the way that they're able to conceive with their partner.
Because with a low libido or erectile dysfunction, I think a lot of people, men may not seek help or talk about that.
Exactly. It's most men will not want to talk to their doctor about it. 40% of men will talk to their partner before they'll talk to their doctor. And, you need to get checked. You need to make sure that somebody's there to help you and work it out.
And what about statins and low testosterone?
Do they cause low testosterone?
Yeah. How does that impact sperm health and low cholesterol and sperm health? Yeah.
So in order to make hormones, you need cholesterol. There were one or two studies that made a correlation between statin use and low testosterone levels. And there's no denying that you need cholesterol to make your hormones. When I've read these studies, I've looked at them and I've tried to understand, how could this be contributing to this if it's outside of your the cholesterol component? And the one way that we can see is potentially it's impacting an enzyme called HMG-CoA reductase, which is responsible for making CoQ10. And CoQ10 is an essential cytochrome in the electron transport chain, which is in the mitochondria, which are necessary to make energy. And this is an essential nutrient for every single one of my men who is looking to improve their fertility. And we know that CoQ10 can help improve fertility and help improve sperm and semen analysis. When you tell me somebody's taking a drug that might deplete them of a nutrient that's necessary for sperm health, then I'm a little bit cautious. But you have to really look at it from the whole picture. A lot of the men who are on statin drugs, very, very few of them have a very healthy lifestyle. So in other words, they're on a statin drug probably because they've exhibited behaviors that cause them to have high cholesterol in the first place. And the solution is here's a statin drug to correct that. But the statin drug doesn't correct the poor eating and the poor lifestyle. It just corrects the number. And what I see is that a lot of these men who have low testosterone who are on statins, most of the time it's not necessarily because of the statin that's causing the testosterone to be low, unless they're very overdosed and their total cholesterol is, below 70 or it's extraordinarily low. It becomes an issue because I think they're actually inhibiting that CoQ10. But most of the men who are on statins actually are already living a poor lifestyle. And that's the other contributing factor that I think's impacting the testosterone is the hyperinsulinemia, the high estrogen levels that are contributing to what we're seeing with the male menopause type of picture that we're seeing more of.
And if they do have the low testosterone, then doing that testosterone replacement therapy is a similar thing impacting the sperm.
Absolutely, yeah. Testosterone replacement therapy is probably one of the easiest ways to decrease your negatively impact your semen analysis, because testosterone replacement will decrease your FSH and LH, and that would decrease the hormones. So FSH and LH are two prohormones that are gonadotropins that are released from your pituitary in your brain, and that tells your testes to make testosterone and also to make sperm. And the communication, what tells your body to make that is testosterone. So estrogen also plays a role in that as well. So when testosterone levels are too high or estrogen levels are too low, your body will sense that and react accordingly. So if testosterone levels are too high, your body will respond and say, oh, no, we don't really need to make any more testosterone, turn off our baby makers. And then that impacts your fertility. And in men who are on, who have very, very low estrogen, who are on estrogen blockers, and we see this in men who are on prostate cancer, they do this intentionally, is that they'll keep their estrogen levels very low, and that'll have a negative impact on their fertility.
So doing the replacement therapy, the Band-Aid approach, not getting to the reason, well, why is it low to begin with?
Yes. Yeah. You're actually not doing yourself a favor if the goal is actually to improve your fertility. There are many men who are on testosterone replacement therapy and they don't care about their fertility. Mm-hmm. But if it's an important thing to you, then testosterone replacement therapy might not be the best next step.
And we talked about this in the beginning, but with obesity, so it's a body fat and the link to low testosterone and sperm health.
Yeah, so it's largely correlated to high levels of insulin and estrogen. So very low levels of estrogen or very high levels of estrogen can negatively impact your fertility. But largely it has a lot to do with your insulin levels. And when you have high insulin levels, it contributes to a pro-inflammatory picture. And again, as we discussed, anytime you're increasing inflammation, you're going to have a negative impact on your ability to make sperm. But more so, what happens is that high insulin level and that high fat tissue is going to convert a lot of your testosterone into estrogen. And remember, you need testosterone to make your sperm. It's necessary. The Leydig cells send it over to the Sertoli cells, and then they take that testosterone as part of the whole sperm synthesis, spermatogenesis. But when you are taking that testosterone and converting a lot of it into estrogen, then you're losing a lot of that benefit, and overall can contribute to our pro-inflammatory state.
Yeah, we have people do food diaries, and then they can see how food actually will impact them emotionally and physically. And then obviously looking at blood chem review to educate, not to diagnose. And if there's anything off there with the glucose levels, having people doing the glucose meter to really, do the blood stick there to see,
Yep.
the finger stick to see exactly what's happening with your blood sugar when you have that potentially more carbs.
A lot of my patients are doing continuous glucose monitoring where they have a device in, whether it's a Libre or a Dexcom, and they're measuring their blood glucose every 5 minutes, not pricking themselves, but they're able to get that measurement every 5 minutes because of the device. And that gives us a really good idea. It's like, who is really a hyperinsulinemic, who might be borderline diabetic. It's very, very important.
Mm-hmm. Absolutely. So low vitamin D, we see this regularly, people with the vitamin D in the single digits and teens for both partners, actually. And so how does low vitamin D correlate with sperm health?
Yeah. So there's been a lot of data on this as well. I think vitamin D is probably one of the all-stars now, just because it's gained so much attention during COVID and how protective it can be. But the vitamin D receptor, VDR, in your genes or in your DNA has such profound impacts on every single part of the body. It helps with manipulating and controlling the inflammatory cascade of particular certain cytokines. That's why we see it might be helpful for certain conditions like COVID. But there's a very strong correlation between vitamin D deficiency and infertility. And again, that is a proxy of unhealthy people, because typically people who are healthy are oftentimes consuming foods that are high in vitamin D, getting out in the sun. But also vitamin D is essential for testicular hormonal production. What we see is that vitamin D is made from cholesterol, but also is an essential nutrient in terms of making testosterone in men. And when you have insufficient amounts, it can have a detrimental effect on testosterone production, and that will have an impact on your fertility chances. We also know that it has other immunoregulatory benefits that perhaps might have a beneficial effect in men who are kind of borderline on the semen analysis, right? And getting their vitamin D levels may help them get over the edge there because of the continuous pleiotropic benefits of vitamin D on various levels. It's pretty much a long list of things that we can suspect that vitamin D will do, but we do know it impacts semen analysis parameters. We do know that it has benefits on testicular or hormonal production. So it's definitely something that's number one on the list that men should be taking, regardless of not if they want to become parents. But I think it's pretty much essential if they do.
Absolutely. And then if it is low, to get testing regularly to see, because you don't want to have, is depending on, it's usually testing every 2 to 3 months. Correct.
Vitamin D, I usually go every 3 months. That's right, because it's fat soluble, so it does take some time to catch up.
And so your approach, so if someone has low sperm count and we're just looking at those numbers, obviously in the functional side of things, we're looking at health history and testing and looking at the whole person. But so your approach, if someone has male factor infertility, what do you kind of, if you have some basic recommendations for diet, lifestyle, testing, kind of what are your go-tos?
Yeah. So obviously these are for individuals where, the female partner is saying, well, it's not me. Everything's working fine on my end. Or maybe it's not, and we need to optimize on both ends. So where I start with a man is, number one, I look at his sleep. Most doctors would go straight to take a supplement or take this medication or take this shot or multiple different interventions that require you a quick fix. And sleep is a long fix because it should be, long. It should be 7 to 8 hours. And it's also a long fix because it's for the life of the person that they should be sleeping. And why is that important is because sleep is necessary for the synthesis of gonadotropins, right? So if you're not sleeping, you're not going to make your FSH and LH, and you're not going to make your testosterone, you're not going to be able to make your sperm. So number one is sleep. Number two, I eliminate most inflammatory foods from the diet. I find that most of my patients find benefit from going off of dairy and off of wheat. It doesn't necessarily always have to be gluten, but because sometimes it's not necessarily the gluten that's problematic. It's usually the wheat germ agglutinin or the lectin in wheat that can be problematic, the specific protein in wheat that we notice outside of gluten. But certainly gluten can be fine to eliminate. And dairy is also a pro-inflammatory food for many individuals. So there's a lot more lactose intolerance in this world than we actually know. And that's just a testament that it's not a necessary food. So I look at those two and kind of nix those out, and then obviously remove all processed sugars and grains and carbohydrates. Those are the top three things that they need to be doing. Now, if they also have obesity, if they're overweight, or if they're insulin resistant, I usually test that using the CGM. You can also do a glucose tolerance test. You can do fasting insulin levels. These are all things that are really helpful in identifying if somebody has underlying insulin sensitivity issues. You have to address the insulin and the obesity and the overweight and the body fat percentage, because that's going to be necessary in terms of optimizing their function. And if you can correct that, then usually they will improve on multiple different parameters. And then I jump to the supplements, and usually I look at zinc, CoQ10, multiple antioxidants, like a mixture of polyphenols that you'll get from a green and red drink. Designs for Health makes a very good product called Paleo Reds. Usually I like Mediclear SGS, which is a great protein powder with a lot of antioxidants in there, including sulforaphane and broccoli extracts in there. And then the CoQ10, as I mentioned, and the zinc are going to be absolutely necessary. Carnitine and acetyl L-carnitine are also necessary, because remember, those help get healthy fats into the cells, and the sperm really want to make sure they have enough energy to get, to do that long journey, and they need fats and sugar to do that. So having enough carnitine to act as a cofactor there, but also as support in sperm synthesis is going to be necessary. Those are my top guns when I look at it from a functional approach. And then as an acupuncturist, I incorporate it into every single one of my programs. It's pretty much a no-brainer for most men and most women as well.
And the acupuncture points, which ones are you focusing on?
So as an acupuncturist, I do a complete TCM diagnosis, and I identify if what type of dysfunction they're having. If it's really a kidney Jing deficiency, a kidney Qi deficiency, then I look more at the kidney points. Usually we'll do kidney 3, 4, 5, kidney 3, 4, 5, and 6. I'll do spleen 6, which can be very helpful as well. And I'll do some urinary bladder points, which help support the kidney meridian, focusing largely on the kidney meridian. And sometimes you'll see liver qi stagnation, where the liver meridian also runs into the genitals, and that can be largely helpful in improving male fertility, especially if they have pain in the genital area. I'll look at things like liver 4, liver 3, liver 8, and then large intestine 4, because it pairs well with liver 3. And then stomach 36 as well, along with large intestine 10, are two combination points that help strengthen the inner and the outer, along with LI4 and liver 3.
I think a lot of women are doing acupuncture, and I don't know what the percentage of men that are actually doing it. What are you saying? Maybe you're seeing a lot because they're all coming to you, but
yeah, I'm a little biased here. Yeah. I think more women are certainly doing it than men. I would agree with that. I see more men for prostate pain or erectile dysfunction than I do see them for fertility. But if their partner's doing it, they oftentimes want to be involved, and they sometimes do it as well.
And so is there anything you're obsessed with right now, as far as a book, a website, an app, a documentary, anything you wanted to recommend?
Oh, man. Right now I'm loving the 10% Happier app.
Okay.
It is a meditation app that I do every single morning, and got off of it for 3 days and then got back on. I was like, wow, I really miss this stuff. So that's my jam right now.
Love it. And a success story you'd like to share with us?
Oh, man. Well, this is not a male success story, actually. I have a patient. She was perhaps 32 years old at the time. She had one child already. She wanted to have another, and her and her husband were told that they weren't able to. She had an AMH level, which came back around 0.4, I believe. I don't test AMH. I find that to be incredibly unreliable.
Yeah.
But that's a whole different story. And the reason why I find it to be unreliable is it has never helped me determine who can become pregnant or not. I think it's a test used by a lot of other practitioners to help them determine, but it doesn't help me determine. So this woman was very distraught and came back to me. She's like, I'm going to have to go do IVF for the second time. The first time failed. She spent about $20,000 to do this. Everything failed. She's like, I'm going to go do this for another try. And I was like, why don't you just give me 4 weeks and let's see what happens. And after 3 weeks, she was pregnant with her second child, didn't have to go through IVF. And she is now, how old is the baby? Well, she might be almost 2 to 3 years old now. And she constantly still thanks me. And it's like, if it were not for you, we'd be $20,000 in debt and wouldn't have this beautiful child that we have. And they were so very happy. So it was a great story because, she was told by her doctors, there's no chance, your AMH is low, you're overweight and you're older and your chances of being, having a baby right now are much lower. It's probably worth you just doing IVF. I'd love to bring hope to people who have been told that they can't do things otherwise. It was similarly to how I got into medicine, where they kind of said, well, this is the only way that we have to help your dad. And I was like, well, there are other alternatives, and I'm going to show you that there are. And I think it's part of my calling and my ability to be able to help other people through this process.
I love that. Thanks for sharing that. And so they can find your website at drralphesposito.com, and I'll have that in the show notes. Any final thoughts on this, Dr. Esposito?
No, this was, man, I can't believe we already went through almost an hour of discussion, but this was amazing. And I really appreciate you having me on. I hope all of your listeners, whether they're male or female, if they're to the fellas, if you're listening, don't deny many times that it can be a male factor, because unfortunately it can be. And to the women, don't be discouraged when your stubborn male partner doesn't want to see the doctor. It's probably 80% of men are in that boat. So just provide them the information and they usually will find their own way.
Awesome. Thanks so much for coming on.
Thank you.
Melatonin is important for female fertility. It helps regulate hormones and maintain the body's circadian rhythms. Plus, it helps determine the frequency and duration of the menstrual cycle. Plus, it impacts sperm count and motility. Blue and green light negatively impact our melatonin production. That's why we recommend Blue Blocks, blue and green light sleep glasses to all our one-to-one clients. Simply go to BlueBlocks, BLUBLOX.com, and use the coupon code GetPregnantPodcast at checkout to receive your 15% discount. That's BlueBlocks, BLUBLOX.com, and use the coupon code GetPregnantPodcast. Hey there, I regularly speak with 5 to 10 couples per week who are struggling to have their baby. And although we want to help everyone, we only have 2 spots available per month to work with us. So the Supercharge Your Fertility Discovery Call is for action takers, and really people who are ready to move forward so they can finally have their baby. And if you're not ready and you wait, the risk is you'll need to wait 2 to 3 months for a spot to open up. So if you're seriously considering working with us, go to Fab Fertile, FABfertile.com, and click on Book a Free Call. Then you'll be all booked in and ready to spend 30 minutes to give you the action plan to getting pregnant naturally. That's Fab Fertile, FABfertile.com, and click on Book a Free Call. I'm excited to offer you a special gift. If you are a U.S. resident, text Fertile, FERTILE, to 55444. You'll be prompted to enter your email address and you'll receive our fertility yoga download. In this 20-minute intro video, we focus on a calming and peaceful practice to connect back to our heart. These simple yoga poses can help quiet negative thoughts and make you feel more in control. Download it now and get started today. For U.S. residents, text Fertile, FERTILE, to 55444. For non-U.S. residents, go to Yoga Freebie, FREEBIE, to access your special gift. That's yogafreebie.com to access the free fertility yoga download. The Get Pregnant Naturally podcast, including show notes and links, provides information with respect to healthy living, nutrition, lab testing, and is intended for informational purposes only. The information provided is not a substitute for medical advice, diagnosis, or treatment, nor is it to be construed as such. We cannot guarantee that the information provided on the Get Pregnant Naturally podcast reflects the most up-to-date medical research. Information is provided without representation or warranties of any kind. Please consult a qualified physician for medical advice and always seek the advice of a qualified healthcare provider with any questions you may have regarding your health and nutrition program.